Cough has been a critical indicator for diagnosing respiratory disease for hundreds of years. Despite the significance and the prevalence of cough-related diseases, there haven't been many convenient tools for objective cough measurements until now. Today, I would like to introduce our recent work published in Allergy on the development and validation of our AI-based smartphone cough monitoring application. At present, most conventional cough monitoring devices used in clinical trials require laboratory settings with manual counting and operation, which is labor-intensive and time-consuming. This consequently makes the solution very expensive and less desirable for everyday real-world usage. Furthermore, the monitoring device is bulky and cumbersome for patients to wear. To tackle this problem, an AI-based smartphone cough monitoring application, Coffee, has been developed to automatically count the number of coughs without the need of human intervention or a special device. The objective of the study was to validate the AI-based smartphone cough monitoring application used in ambulatory settings and not in an acoustically sterilized laboratory setting with real respiratory patients having various cough symptoms. To perform the study, 130 respiratory patients with cough symptoms were recruited. The causes of their coughs have been diagnosed before the study, which included asthma, upper airway cough syndrome, gastroesophageal reflux disease, eosinophilic bronchitis, cough hypersensitivity syndrome, and others. Each participant recorded their ambient sounds at home with the Coffee application during a wait time for 1 to 3 hours and during sleep time for at least 5 hours. The recordings continued for 2 consecutive days. The results are shown here with the bar graph with the manual counts in blue and the AI algorithm counts in orange compared side by side. Overall, the 2 graphs show high accordance and agreement. The sensitivity and specificity of the AI-based algorithm were 92% and 99% respectively. These are significant values considering that the recording was done in an ambulatory setting at a patient's home with the presence of natural noise and not in a laboratory setting. Also, it is worth noting that the study was conducted with real respiratory patients with spontaneous coughs and not with voluntary coughs. These promising results suggest that our AI-based fully automated smartphone cough monitoring application can become a very powerful tool for real-world everyday cough monitoring solutions. We're planning to further investigate longitudinal cough monitoring for asthmatic patients to track the progress and improvements after treatment. Stay tuned for our follow-up study for more interesting results, and thank you for your attention.